Hello everyone, Dr. Darvish here. I wanted to make some comments on this question regarding Advil versus Tylenol during this COVID-19 pandemic. So initially, when some reports were coming out of France, they were discussing the use of Advil causing further complications, or there would be a correlation, or maybe I should say, between the patients who had more complications with the COVID-19 and the use of Advil. A few days later, the reports changed that Tylenol might have been playing a role in the extent of complications with COVID-19. While both of these medications are over-the-counter, are often used for pain relief or fever, and from a holistic perspective, if you are fighting a fever during COVID-19, we need to understand why and allow the fever to do its work. The body produces fever in order to fight an infection. It's an immune response. It's a sign that your immune system is actually working. So it's a good thing when you do have a fever, because it tells us that your immune response is happening against the infection. That fever may be fighting, that immune system may need to fight for days, and hence your fever may be prolonged. The research from the past looking at common cold viruses and other flu-like viruses have shown that when people do take fever-reducing medications, that the virus is prolonged, that the symptoms of that infection are prolonged. So the head cold, the flu-like symptoms, everything is more prolonged when you take fever-reducing medication, because in essence, you're suppressing your immune function. And so I've always been trained as a physician, as a naturopathic physician, to allow the body, to listen to the body and allow the body to do what it's meant to do, and understand why it's producing some of the symptoms it's producing. So as long as the fever is not going too high, not above 103 or 104, and you're feeling comfortable, I would just allow you to ride the fever. People do get uncomfortable over 102 temperatures, so oftentimes using the old-fashioned techniques of a cold pack on the forehead or in the back of the neck, or washing your feet in tepid water with some salt, just the old techniques to bring down the fever just enough so that it makes you comfortable, but it's allowing the immune system to continue to do its work against the virus. There's also some homeopathic remedies that I have used in the past, belladonna being one where people have really intense redness and hot. So it's a great one that often is indicated for patients who have a very high fever and are very, very, very hot and uncomfortable. It tends to help reduce the fever just enough, but not too much where the immune system is suppressed. Combinations of homeopathic remedies out there, tea relief or Traumeel, also can be very helpful in such cases as well. Also, looking from a holistic perspective regarding Advil itself, Advil and ibuprofen have a toxic effect basically on the kidneys, and they don't allow the kidneys to eliminate toxins like they're supposed to. So when you are taking Advil or ibuprofen, number one, your risk for kidney conditions goes up. But secondly, even if you don't have an increased risk for kidney disease with Advil, the kidney function goes down, and the body's ability to eliminate the remnants from the viruses that have been produced as a result of your body fighting and eliminate or killing infections. The elimination of these remnants, these toxins, are reduced through the kidneys. And we want to optimize elimination from all organs. This is one of the reasons our body sweats when we have an infection. because the skin is releasing those toxins, those remnants from fighting off these infections. We tend to have diarrhea, and that's another source of elimination of these infections. Frequency of urination, especially if you're drinking a lot of water, which you should be if you're fighting a fever or an infection, to continue to help the body eliminate. So Advil and ibuprofen reduce the body's ability to eliminate through the kidneys. Tylenol, on the other hand, reduces the liver's function and is known to be a cause of liver toxicity and in some cases liver failure. So we have to be really careful with the use of Tylenol or acetaminophen or any derivatives of acetaminophen because of the liver. Now in COVID-19, we know that it leads to a multi-system failure, the liver failure, kidney failure, so forth. And so it is even more important in my mind that we keep the function of the liver and the kidneys as optimal as possible. And so reducing the use of Tylenol to reduce our risk of liver toxicity and use substances or nutrients that promote liver detoxification and promote liver health is going to be really important. So for instance, using lemon in water is going to be really beneficial in some cases, because not only are you getting the vitamin C and some of the bioflavonoids from the lemon, but also the bitterness of the lemon stimulates the liver to detoxify more efficiently. Carrots, beets are other vegetables that help the liver eliminate. So instead of shutting down your fever through the use of Advil or Tylenol, you may consider using some of the natural remedies of just plain old hot and cold water, salt water over your neck or back and forehead, and even maybe in some cases full body cool baths to support your immune system but make you more comfortable. I hope this helps you, and please keep safe and healthy.